everybody. Welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. We are so lucky that every week we get to come here and chat with someone new, who is in a new specialty every week, and just getting really good information and most importantly, different perspectives. And so today I have a really awesome special guest for you. I want to introduce you to Dr. Angela Tharnish. She is the owner of Charleston Pain Relief Center. Dr. Tharnish, welcome. Thanks so much.
Yeah, thank you. This is exciting to be able to participate and disseminate more information on some of the really cool things that we're doing. So thanks for having me.
I'm very excited. I know we have a lot to dive into, but kind of the way I'd love to start off is, and I think what gets everyone really interested is just hearing your story. I love the origin story. What inspired you to, maybe get into your specialty, or maybe what made you start your own practice?
Yeah, definitely. It everybody's got their journey and their story, right? So
Yeah.
I'm a chiropractic physician by licensure and education. I started seeing a chiropractor when I was about 16 years old, and I had suffered from migraines since the age of 11. And I can remember very vividly like having to go in a dark room and take this nasty medication, and just I could the one memory in particular, kids being outside playing while I was inside dealing with this migraine. Yes, again, very vivid. And I actually, at 16, ended up having kind of a minor car accident, and that's what led my parents to take me to their chiropractor. They had been going, but it just had never really come up to take their kids. And so I got treated for some of the soft tissue injuries after the car accident. But then what I noticed was, again, my headaches were better. My allergies started to improve as well. So that was really cool. And then fast forward to, I stayed under care. Now I'm in college, and I thought I wanted to do athletic training, which then morphed into physical therapist. And I went and shadowed some physical therapists, and I left literally that clinic, and then had a chiropractic appointment. And on the way over there, I was like, man, I don't know if this is my calling. And I just wasn't sure. Go to my chiropractor. He had known me again for probably 4 or 5 years at this point. And he's like, what's going on? I said, I just don't know what I'm going to do with myself, in all my dramatic, however 19 years old I was. And I told him what was going on, and he said, have you ever thought about chiropractic? And I said, my first response was, well, do you think I can do it? Because he's about 6'2", he's a man.
Yeah.
So that's all I had ever known. And I am 5'1" and a female, and very small and petite. And he did not hesitate. He said, absolutely. The way that I do it isn't the only way to do it. And I have such an affinity for the human body and anatomy that things started to check off. And then, like, the goals that I thought I had for myself, for my life, I was like, yeah, this fits. It's a holistic model. I had already given up soda when I was a teenager. I just, like, these little life choices I had already started to make because I knew how I felt, and I knew the experience that I had had with chiropractic. So that's kind of my origin story as a physician. And, my family jokes that I was probably destined to be my own boss because they were not sure that I could work for somebody. Let's just put it that way. So
I love it.
driven, yeah, just driven by, wanting to do things my way is probably what led me into owning my own clinic, into the entrepreneurship side of things. And then, I've had my clinic for 17 years, and looking back over the course of those 17 years, things have morphed a lot. And the last 5 years have been very rapid of addition of things to our practice. And at the core of that, I think, is my purpose and my passion, which is to help as many people as possible. And chiropractic is fantastic, and I have changed lives, and my other doctors have changed lives. But people are getting sicker, and there's so much toxicity in our environment that an adjustment it's just not enough anymore. And so I've constantly for what's next. And that led me to where we are today, and really how I think you found us, which is the new things and the new technology that we've been adding. And we're literally getting ready to add another new piece of technology in this month. So yeah, I guess I'm never satisfied. I want to be able to help people in profound ways. So
Yeah, well, something interesting that you said was I think we all have these core memories in life as
yeah,
youngsters, and we say to ourselves, never again, or I don't want to be on that path. Or, I even remember being a little kid with allergies, watching the rest of the kids go out for recess, and I was a
yeah,
snot mess, and it was not going to
yeah,
happen for me, right?
yeah,
And it's kind of the same thing for you. And so I think for a lot of the people that come on here, I think their why is very significant. And to never go back to that place, or to recognize how you
sure,
feel in that moment and know that things can be better, and you saw it, or you had really great people that took you to the right place at the right time.
for sure.
So I think it's really incredible to hear everyone's stories, hear your story about, you weren't just satisfied with what was,
Hmm.
and wanted to continue to make the difference in your own life, and then turn that around to the people that you serve. Um,
Yeah,
which is
100%.
most important. So kind of speaking about the people that you serve, there's a lot of different things that you do that are under
Hmm.
your umbrella. So I would love to know, maybe, what are some of the common things that you treat, or issues that you treat, but also maybe some lesser known, things that you do.
Yeah,
Because I
yeah,
think there's so much more that meets the eye in chiropractic, but also bringing in a whole bunch of other modalities to help aid in someone's success in their health journey. So what are
yeah.
some of those things for you, the common and maybe the not so common?
Yeah. Yeah, the most common thing that we treat is low back pain.
Sure.
It's just statistically, I'm not going to throw out stats. I've never been that person to memorize a stat, but statistically speaking, there's a majority of Americans, I think it's as high as 80% of Americans will experience back pain at some point in time in their adult life. So that's a lot of people.
Yeah.
So that is honestly the bread and butter for most chiropractors. And back pain can be, really straightforward, musculoskeletal joint related, and then can get really complex with disc problems and nerve problems. So in my practice, we have a multi-dimensional approach to treating lower back pain. We have decompression that targets disc problems. We have treatments for nerve issues, and then the spinal manipulation to help remove pressure on nerves, help restore joint function. And we really try to focus on posture. That posture correction has been something that's really become, people have become really more aware. And it's been really interesting over the course of my 17 years. This is where I get to insert that the millennial generation has done really well to be aware of this, because I hadn't seen it before the millennial generation, which is just behind me, started coming into my practice and openly saying, I am concerned with posture. So that's really good. So those two things, very common. Neuropathy is a very, very common condition that we deal with. Most neuropathy is diabetic related. Again, statistically speaking, tons and tons, millions of Americans have diabetes that are also uncontrolled. Uncontrolled diabetes leads to vascular issues that cause nerve problems, and it most commonly presents in the feet. So we see and treat a lot of that. And then some of our less common things that is in the wheelhouse of the new services that we're adding are this concept of chronic diseases, things like long COVID, chronic Lyme, and then chronic fatigue kind of pairs into a lot of that, but also toxicity. So we're treating a family right now from Georgia that had been part of their community had a chemical fire from a chemical laboratory. Yeah, it's a really, really terrible
Oh,
story.
awful.
Yeah, this just happened in August. I think it was August of last year. And this poor woman has received chemical burns from inhaling what was aerosoled into the atmosphere, so in her lungs. So again, chiropractic isn't going to help that, but our EBOO and ozone treatments are. And so that's been really exciting. So we do so few of those types of treatments in a week, partially because it's new, but partially because it's the amount of people that have those conditions is far less when you're looking at the whole of the American population, if you will. So but those are the really impactful. Not that low back pain doesn't change people's lives, getting rid of it, but these other conditions that are a little bit more, I would say, on the fringe, they're actually so detrimental to people's lives. And that's one of the reasons why I wanted to do more for
Yeah.
them.
With some of the things that are maybe, as you said, I like that word, on the fringe.
Yeah.
It's I'm sure it's difficult to diagnose. People don't always know
Yeah.
all the time what's going on, and they're coming in with these symptoms. And it's a really difficult place to be when you go somewhere and maybe you've been to a few other people that have been unsuccessful in treating you, and like because they just didn't have the right equipment or protocol to do so. And so I think that's why these particular things that you're talking about, the new technologies that we're advancing, that is so amazing that you have, but are better able to treat some of these things that are on the fringe, and that can help people aid in their recovery and success, because
Absolutely.
it is so difficult. So I'd love to ask you, what about your approach and your protocol is so different? I know you're using all these different technologies, but what do you think in combining them all,
Yeah.
and making the Goldilocks recipe to making someone better? How does that work with you guys?
Yeah, that's a great question. I think it always for me goes back, and this is the way that I've practiced from the beginning, even when I had just a chiropractic, mostly focused practice. It goes back to that as beings, as humans, our bodies are not, they don't function in isolation. And without sounding overly critical of the medical community as a whole, it's become so specialized. And that's what happens, as you kind of are alluding to, that there are patients that end up with mystery symptoms, and they go from one specialist to the next, to the next, to the next with
Yeah.
no answers. And part of that is because they are looking at the symptoms, not the root cause. And so they're treating symptoms in an isolated system. So, excuse me, if you have
Right.
digestive issues, you have acid reflux, they're just looking at the stomach. They're not looking at, well, why? Why do you have acid reflux? So that's truly the core difference in our practice and practices like ours. We're looking at the whole being. How do we address the root cause? And truthfully, the primary root cause across all disease is inflammation. And this has been well established for over 20 years. It was in, I believe, 2001, so well over 20 years ago, the cover of Time magazine
Mm,
said inflammation, the silent killer. So
interesting.
yes, and so that's major publication. So here we are, fast forward, it's 2025, and it's just, in my opinion, just now gaining more traction in the last less than 5 years of talking more and more about inflammation. I've known of this and been trained on this for decades now at this point, and the research is solid. It's there, but it's been ignored, because to think that if there's also causes for inflammation: food, water, air quality, medications, and then disease processes you throw on top of that. So if you don't ever put the fire out, all of the embers, the fire can come back at any time.
Oh, certainly. Absolutely.
And so the treatment protocols now that we're utilizing, especially with the addition of EBOO, and I know we wanted to get into that today. So EBOO therapy is to get to calming and hopefully resolving the systemic inflammation in the body.
Mhm.
And once you do that, then any other treatment that you do for any other condition is going to go better. But you have to put the fire out first. So I use the example of a wildfire and you're taking a Dixie cup of water to it. And that's the approach that most of healthcare is doing right now. And it's not getting people better is the sad part.
Mhm.
So doing that, getting the inflammation down, and then doing targeted treatments to the primary areas of dysfunction, whether that's the gut, whether that's neuropathy with the feet, whether that's back pain. Now, anything else we apply is going to work better.
100%. And just because EBOO is so new and there seems to be this craze behind it, but I
Yeah.
still think largely a lot of people are not well informed about what EBOO is. And if you could just tell us a little bit
Yeah.
about, who's using it, why is it important, how is it helping people? I mean, you explained in a little bit of the ways that how it's
Yeah.
helping people, but any other course of treatment that you think it could be effective for would be
Yeah.
great to know.
Yeah, so EBOO stands for extracorporeal blood ozonation and oxygenation, and extracorporeal meaning outside of the body. So your blood is taken out of your body and then it is exposed to ozone. And then the way that we do it, which is literally the newest and greatest, is also exposing it to full spectrum light. So there's a lot of really magical things that happen with the ozonation and the full spectrum light. Um, when the blood is exposed to that, and then the blood is returned back to the body. So ozone therapy has been used for a very long time. It helps with antimicrobial types things, but what it does is ozone is three oxygen molecules. It's highly reactive. It doesn't want to exist as three, so it will turn into O2, which is the oxygen that we use. So being able to over oxygenate your cells is also really great too, because then all that gets carried back into your body.
Mhm.
Full spectrum light is really, really cool because of how it affects the hemoglobin part of your red blood cell. So the hemoglobin is the part of your blood cell that carries the oxygen.
Mhm.
So here's the awesome synergy of some of this, just a tip of the iceberg. So the hemoglobin gets overactivated with the light, makes it more efficient at carrying oxygen. And then
Mhm.
you've got the ozone there and it's going back into the body. And then those red blood cells now have been supercharged and they go back into your body and they're able to go in and do a lot of work. They're able to remove toxins better. It's able to deliver oxygen better. And so then that's where, if you just know those two facts, now start to think of at a cellular level what it's capable of. So EBOO, those two things, and then the biggest thing that it does is it helps with immune system function, or what we call modulation. So if your immune system is supposed to have a baseline, your immune system is over functioning, let's say in an autoimmune condition,
Yes.
lupus, things like that, it's overactive. EBOO therapy will help bring it back down. If you are chronically sick and you have active infection going on, so your immune system function is actually poor, it will help bring it back up. So
Mhm.
it's a great way to help start regulating your body to get you back to what we call homeostasis. So
Yeah.
those are, like, in its simplest form, what it's really good for. And really, in that breath, I definitely wanted to make sure that I I talked about some of the misconceptions, because there is a ton of people posting information
Yes, I was
and
gonna ask
videos.
you about that because
Yeah.
I mean, that you got the Shark Tank people posting
Yep.
about it, and you have
Yep.
other folks that are just starting to dabble in, and it's one of my favorite things to ask here is because not only in terms of what you do, besides chiropractic, but also there's so much misconceptions within the healthcare field,
Yep.
right?
Yep.
I think every specialty, it goes against the masses.
Yep.
Everyone has some kind of misconception, and so I definitely want to hear misconceptions that you have with EBOO, but anything that you want
Yep.
to set the record straight on,
Yeah.
okay?
Yeah.
Feel free.
Now's my time.
Now's your time.
Yeah. Yeah, well, and what's funny is in the way that we're doing this right now, right? We
Yeah.
are truly experiencing this massive age of information. And then you add in AI and there's so much information so readily accessible.
Yes.
So what's fascinating when you're at the cusp and the cutting edge of new things is we're playing on the edge of what's known and what's unknown and what's speculation. And that's where EBOO is.
Mhm.
And I'm thankful that I'm getting into it at a time when more is known because then I can actually speak from a factual place rather than speculation.
Sure.
So what's out there in a lot of the other videos, and a lot of biohackers, and they've posted the things that they're saying that they're delivering as fact aren't that it's not, it's speculation. So the speculation is that there's this froth bucket byproduct that comes off, and that's pulling toxins and plastics and hard metals and things. That's actually not true. It's just literally kind of like, if you think of, this might be an archaic or a very oversimplification, but if you think of like whipping eggs, if you whip them enough, they get frothy and you create a meringue. So your blood's not getting whipped as it goes through, but it is going through this whole process, and there's air that's going across it. So there's this byproduct that comes off of it. So there's people that have finally been studying what this is, because for the longest time it's like, oh yeah, that's all the bad stuff coming out. And now it's just known that it's not. It is less load on your organs to pull that stuff off. So in essence, it's almost like a byproduct like urine. So that is waste. So that's good. So your kidneys didn't have to filter that. So that's nice. And then this whole concept that EBOO is actually filtering the blood. That is not true. It is using a filter, but the filter, what it's doing is it's creating more surface area for your blood to be exposed to the ozone. And
Sure.
so that's a
Yeah.
huge distinction. And how we were trained, me and my team, is to make sure that we are not saying it's filtering, because the people that are in this space are really passionate about making sure that we're all educating accurately. So EBOO does not filter the blood. It, again, oxygenates, ozonates, and exposes it to full spectrum light. And those results and those benefits are well documented across all fields of medicine, to help with chronic conditions. So that those are probably the biggest things
Yeah.
to,
For sure. Is there anything else? You had mentioned neuropathy,
yeah.
and I think there is a lot of misconceptions with
Yeah.
neuropathy. And so is there anything that you would say to folks now that maybe think that they have it or not sure, or you've been told old wives' tales about what this is? I would love to hear your feedback on that.
Yeah, and thanks for circling back to that, because it
Yeah,
is neuropathy, of all of the conditions that we treat in the clinic, it has some of the just most heartbreaking effects, and really that's amputation. There's very few things that I can think of happening to a human than that could be more just devastating than losing a limb.
yeah,
And that's what neuropathy patients, especially specifically peripheral neuropathy patients, are potentially faced with. And
sure.
they go and they get diagnosed. And sometimes people are diagnosed and they're just based on symptoms alone and the fact that they're diabetic. And that's nobody's done a neurologic exam. Like, it's really important in our clinic. We do a thorough neurologic exam so we can map their deficits. So that's step number one. If you've never had a neurologic exam, how do you really know what type of nerve problem it is? So
Sure.
peripheral neuropathy having a true vascular component, and the underlying issue with that vascular component is inflammation. So
Mhm.
inflammatory process that diabetes has contributed to. Toxicity also, they can have chemical exposure that causes neuropathy. Post chemo patients have peripheral neuropathy pretty badly because of the chemical of the chemo.
Yeah.
So the blood vessels get damaged. The lack of blood to the nerves causes the nerves more or less to die. This is what potentially leads to the amputation because the skin starts to die. They get a wound, it doesn't heal, it gets infected. Boom, now they've lost a leg. And it can happen that fast once it's to a certain point.
Sure.
Um, it's usually a slow progression, and people don't really pay attention to it. And one of the problems is they go from burning pain to tingling to numbness pretty quick. And as soon as they reach that numbness stage, they're like, oh, my feet don't hurt anymore. But then they don't realize how much sensation they've lost. Yeah. We examine people all the time and they'll have complete lack of sensation all the way up their shin. And they won't know. They literally cannot feel a pinprick all the way up their shin. And
Wow.
they're like, oh my God, I had no idea. And so that's really eye-opening for them. They're like, wow, I didn't realize I was this bad. I really need to do something about this. And it neuropathy, when they go to, their doctor, whether it's an endocrinologist or primary care neurologist, nobody has a solution for them. They usually put them on gabapentin or other pain medications. And I mean, we've literally had patients tell us the stories that my doctor put me on this medication. They asked, okay, and then what? What am I supposed to do? They're like, well, you stay on this and we keep upping your dose if you have symptoms. And then you may end up losing some toes or a foot. And, the patient is like, well, that escalated quickly. And they're given literally no other guidance, none.
That's
And
so scary. That's so scary.
extremely scary. And you're taking away their hope that there is anything that can be done. And so we've been treating neuropathy for several years with our class 4 lasers, and we get very good results. The reason though that works is because it helps restore blood flow to the area. It helps with cellular healing and cellular activation. And so got really great results with that. And then as soon as we added EBOO to the practice, then it was like, okay, this now is going to treat
Mm.
the major underlying inflammation, helping to oxygenate all those areas. So what we do a lot of times
Mm.
is the patient will be hooked up to the EBOO treatment, and then we come in, one of the laser techs or myself, and we are actively lasering their legs and their feet while now this great blood, right, is being returned to their body. And if you've ever had an IV before, you have realized how quickly things can get through your body. I think we talked about like vitamin,
Yeah.
infusions, and you taste the vitamins in your mouth within a minute or two. So it can go really fast. So they're hooked up to the EBOO machine for 50 minutes. So if
Yeah.
we can laser their feet,
While
so
that's happening.
right, so it just compounds everything. And then one of the other things that we've added is our Softwave treatments as well. And Softwave is helping, it uses a more electrical stimulus,
Sure.
but this frequency of electrical stimulus into the body sends signals to pull your stem cells into the
Mhm.
area. And your stem cells are think of it as like the infantry going in to like fix and repair tissues. So it's going into that damaged tissue. So this is why I get so excited, because this is like this beautiful package protocol now. And I don't say this, I say this cautiously, but I don't know that anybody else has put all this together, because there's so few clinics that have everything that we have. And that's why we're really excited to be able to start offering this protocol, this neuro restore protocol, to the community, because it can literally reverse this condition. And these people have never been told that that's possible.
Yeah, I mean, and that's why I wanted to talk about it because it's something that a lot of people deal with. It's
Yeah.
obviously something that you commonly treat. But I think people are left more often than not with no hope,
Yeah.
or not a great treatment path, or how you said things can escalate pretty quickly,
Yeah.
and it's pretty scary as well. And so I think it's a great thing to talk about, but to bring awareness to, and something that I really like that you do and that you've been constantly doing throughout this entire session is just, you know, whether it's a metaphor or explaining how something works, so that anyone can understand
Yeah.
it. Someone like me or another provider that's watching that is very interested in probably getting a little bit more clinical with you, um,
Yeah.
on what some of this really does. But this makes sense to me as the person. It's kind of like going to mechanic, and I love when they take you actually behind and they say, okay, this is what's happening to your car, and let me show you, and this is why we do this. And then it makes a lot more sense than just getting whacked with some bill, right? And you
Yeah.
have no idea what you just paid for. So, in the vein of understanding and to actually move, our health in a better trajectory, I would love to get maybe some pro tips from you, just because you have some really great ways within your office and how you
Mhm.
help people. But what is something that maybe we can all do today that can, move our life forward in a better trajectory, but also maybe for the folks that are listening and intrigued by EBOO or some of the other, therapies, Softwave, other things that you're doing, what would you say, or maybe weight loss solutions as
Mhm.
well? What would you say to maybe some of the skeptics? Because we did talk about that, because there's a lot of,
Yeah.
you know, emphasis on these things that are happening in our world right now. But what do one, recap, what are we going to say to folks to move our health in a better trajectory? And then what do we say to the um, confused or
Yeah.
naysayers of the group?
Yeah. Yeah, absolutely. It's somebody said yesterday in the office that it we were reading a training thing, and she one of my employees said, "Yeah, I love how this always says it's not that complicated."
Mhm.
And that in a nutshell, I think is what happens definitely in healthcare and definitely with any sort of health promotion. It gets so overly complicated, and then people end up with information paralysis.
Yeah.
Or people want to say, well, I have the best protocol and you need to do it in this order to
Mhm.
have the best results. And they're not wrong, but if you're trying to help somebody just make better choices,
Mhm.
it doesn't have to be that complicated. Um, one of the tried and true things that a lot of healthcare practitioners, holistic like myself, have been beating for years is get back to simple whole foods. One of the people right now that has become there's several people online, but I guess one of the most prolific because she's become the forward face of this is Casey Means, who is up for Surgeon General. Callie Means, Casey and Callie, the Means brother and sister, and she is been nominated to become our next Surgeon General, and it
Mhm.
this could be transformative for our country. But I love that she's been talking about this. And again, in my space and in our holistic community, we've been talking about this for decades. Whole foods. Stop eating processed foods. Stop going through the drive through and thinking that, oh, I'm just going to get a quick meal. That food does not serve you. It just doesn't. There's nothing about it that does. So that's number one, get back to whole foods. Drinking more water. Most people are not drinking enough water to flush their system. And a lot of this goes back because people, naysayers, will be like, well, we haven't always drank this much water. Well, we also haven't had this much toxicity. So you have toxic foods that you're eating, and your body needs help to flush that out. And the way to do that is to make sure you're properly hydrated. Proper hydration takes the load off of a lot of systems in your body because it makes your blood less viscous, less thick.
Mhm.
So you're going to get better oxygen, you're going to get better nutrients delivered if you're hydrated. So whole foods, hydration. Sleep is a funny one because I joke when you're in the trenches of life, like my kids are now finally teenagers, but when you have young kids and you're working and
Yeah.
people, there's influencers all over social media. You have got to prioritize sleep. Well, how the heck do you do that?
Yeah.
Like
How does that work?
it doesn't. So
Yeah.
I think
What do we
being able,
do?
right, right.
What do we
So
do?
I think the concept of trying to build your schedule so that maybe not every night you're going to hit 8 hours. There
Sure.
might be some nights where you get 5, but then making sure that you catch up. This concept of a sleep deficit is cumulative, but you can also help reset it by having, like, on the weekends, if you
Yeah.
can sleep in, or if you do have young kids, make it a point to go to bed, excuse me, when they do, a couple of nights a week. You
Yeah.
have to, just like prioritizing your food, you do kind of need to set a sleep schedule. So those 3 things, they're free. Make better choices. That doesn't cost you anything. And then there's simple little things like you can add in doing Baja Gold salt in your water. That's super cheap. That gets you a lot of minerals. And I love that tip and trick. I'm not one, so I don't preach this a ton, of taking a lot of supplements. I'm terrible at staying on a supplement regimen. So that's where I like to focus on getting it from my food. And trying to be more active. I guess that was the last thing I wanted to make sure that most humans in our society don't move enough. Again, that's free. You don't have to join a gym. Go for a walk.
Yeah.
People say, well, if it's raining or I have a bad back or a bad knee and I don't feel like I can walk for very long, walk around your house. You may feel silly doing it at first, but just start doing laps around your living room, and that'll start to make a difference. And the naysayers of, well, you've got to do this, you've got to do 30 minutes of exercise. It just, again, it just doesn't have to be that complicated. You have to start somewhere. um, Toddlers don't, we joke they go from crawling to running, right? But that actually doesn't happen. They have to learn how to stand, they have to learn how to take a couple of steps
Yeah.
before they can do that. So same
Absolutely.
thing as adults. You have to crawl before you can walk, before you can run, and just making it simple. And not, people need to be kinder to themselves, I think, too, when they're on a journey. We see that a lot with weight loss patients. They have a day where they may have made some bad eating choices. Just get back on it the next day or the next meal. It doesn't have to be so, like, detrimental, like, oh, I'm just a failure. Be nicer to yourself. And that'll go a long way. I really believe.
I really like your approach to this one. And it can be simple. I think having done many of these, getting a lot of advice, but the one thing that you do is, it's a very simple journey. The one small thing. You don't have to reinvent everything that you're doing, and also know that that's not possible. Talking to the parents that are out there, that they're not going to get consistent
Oh,
great sleep, and
no.
so make it up. There's other pathways. If you can't walk, do it around your house. There's, for everything that someone might say, no, I can't, or I can't do that, or have some excuse for this, you've come up with an even simpler way to, do that one thing to achieve the goal and make it slightly better from where you are today. And I think that's the important part. Yeah, you don't start out as the baby, crawling. You kind of stand up and you kind of look like a drunk baby,
Right,
getting up there, making your first couple of movements, and you're
right,
swaying back and forth. And then, yeah, okay, then you walk like a normal human at that point, right?
right,
But
right.
it
Absolutely.
takes time. So I think sometimes we're all guilty of that. We are in a bad place and we just want to start and, okay,
Yeah,
I got to buy all these things. And I love how you said this is all for free.
yeah,
All for
yeah.
free.
Just making different choices. And I've really tried to even get away from saying making better choices, because I think there's too much judgment that we place on things, and like, well, now I'm bad because I did hit the drive-through. No, you're not bad. You just made a choice that doesn't further your goal. So what's your
Yeah.
goal? Then get back on it with the next choice that you make. The next time you eat, make a different choice.
Yeah.
And it's more about the net gain again. And if you can't prioritize exercise or you can't prioritize sleep, then make sure you're prioritizing your diet. Make sure you're prioritizing water because you have to do those two things. You can't get away from that. So it is the journey, and there's so many across, you know, spiritual practices, right? It's the focus is your practice and your journey. And your health really should be seen in the same light of this is a journey, it's a practice. I'm constantly working at it and evolving. And if, like me, you do things for a little while and then you learn about something else and you're ready to take it to the next level and the next level and the next level, then that's great. Or you find your sweet spot and you just continue to refine that and do that part really, really good.
Absolutely. I wholeheartedly agree. And just to finish out everything today, because you gave us such great advice and really great perspectives, not only on what you're doing, but our lifestyle and health. I would love if you can tell everyone where they can reach out to you guys, whether to set up an appointment. They have more, maybe some more questions about EBOO, or anything else to, reach out or just get some more great information.
Yeah, we have we're across all platforms now because again, trying to get information out there and be as accessible as possible. Charleston Pain Relief Center.com is the website, and that's where you can find us on YouTube, on Instagram, on Facebook. You just look up Charleston Pain Relief Center.com or Charleston Pain Relief Center, and we actively myself, my partner. We do have some other team members that do help watch like DMs, and then the contact us forms on our website. That's literally the easiest way because it just dumps right into us. And if it's a question, I've told people if you have a direct question for me and you contact on any of those platforms, just say, hey, this question is for Dr. T, and then ask your question, and whoever sees it will notify me that, hey, you have a specific question, and then I'll get back to you. I tell people all of that's great because you can do it at all hours of the day. If you're sitting in bed one night because you can't sleep because your feet are burning, you can hop on Facebook and you can DM us. We may not answer at 12 a.m., but we're going to see it when we get up and get active, and we're going to get right back to you. So yeah, again, my purpose is to help as many people as possible. And I am grateful for platforms like this and all of the tools that we have nowadays because it helps me get excited about the reach. And it's not just going to be in my local community anymore. It's going to be far reaching. And whether people come to me physically or they get information and they can find a closer practitioner, then I've served my purpose. And it really is satisfying to hear, the success stories, which there was one I wanted to share with you,
Yeah.
um, because I think it's really profound. And anytime I get a chance to share at least one success story, whether I'm in a platform like this, anybody that's trying to reach out like yourself and just help improve life, right? I think it's important that you understand the work, even to Rachel, that you're doing has an impact because people will see it and you don't realize how you affect people's lives when you're behind the camera a lot.
Yeah.
And it's these little stories that then if I share a testimonial that somebody else is going to see that you helped them see this. So one of our EBOO patients who has had long COVID and he's very young. He literally just got married. I say very young, he's 30. He had been having vertigo type symptoms to the point where he literally could not function. And if he was not a self-employed person, I'm convinced he would be out of work because it would get so bad he would have to lay down. He's been to Boston and he's been to Louisiana to see different specialists for this. And it was one of those doctors, an ENT, that said, I've seen this with post-COVID patients.
Mhm.
So he's been suffering for 5 years, completely on a path to having his life just over, more or less. He finds out about EBOO. He finds us. He has had 4 treatment sessions at this point.
Yep.
His scale of ranking, he would say his 10 out of 10 day, again, debilitated on the couch. So he had days, multiple days a week that were a 10 out of 10. Now, after 4 sessions, he's at a 3 out of 10. And his worst day is a 5 out of 10. So he is that snapshot of somebody that we are doing something with that is potentially going to change the trajectory of his life. And that's why sharing information like this in a really holistic but casual way, getting the information out. And so I applaud you for what you're doing as well, because people will hear it and they will see it and they'll be like, oh, yeah, I should look into that. And
Yep.
this is how we all get better. This is how we create a better world. So thank you for your part in this.
I appreciate it. I always say that every person, is kind of like a tree branch on a tree and it just keeps
Absolutely.
growing. And, it's nice to know that one person can change someone else's life and then that person tells that person and then it creates this wonderful community of people helping each other. And that
Yeah.
that is what this is all about, is for us to get great information from reputable, amazing private practices like yourself. But for us to help one another in our communities and people that are willing to listen, people that are perking up their ears and invested in their health and health care and what's happening in our country. So,
Yeah.
Dr. Tharnish, this has been amazing. Thank you so much for being on here today. And we really hope to have you on again soon.
It's my pleasure. Thanks so much.
Thanks.